I'm Starla Hairston Blanks. My background is having a master's degree in business administration, and I'm an online student here at the University of New England. In my professional life, I'm the director of health promotion and policy for Morehouse School of Medicine's Community Voices Project. I've been working in the public health industry for 10 years now in different arenas. I've worked in women's health, and now I work in health equity and policy development. So 10 years of service before joining UNE. I chose UNE because of the flexibility of the online program and also the generalist approach to public health. I found having a diversity background in public health practice that I wanted to make sure that my educational experience was just as varied. UNE was the most flexible program that allowed a working professional to get a generalist overview of public health, and as well as having opportunities to interact with students from all over the country. I was really surprised at how quickly I was able to start applying some of the coursework from UNE into my daily application. Right away from taking public health foundations and principles, I gained a whole new toolbox full of different public health theories and modules that I started using in my day-to-day life. I found it to be extremely real and applicable to what I already was doing in the field of public health. So I feel like UNE made me a better health professional. The faculty of UNE is wonderful. They are so passionate about the topics that they're discussing and they're teaching in each course. And also, I was a little worried at first about would I have the same type of interaction you would have in a traditional program, but I found the faculty members to all be really open to having communications, whether it's through Skype or email or through using the Blackboard discussion tools. So I've really enjoyed the interaction with the faculty, and their passion has rubbed off on me on some issues that I really hadn't taken into account before I joined the program. My goals post completing the program, I hope to have my DRPH in public health, and I think the foundation from here is going to be a big part in me receiving my doctoral degree. And then I see myself running a larger public health agency. I want to provide some sort of health outreach service or health policy service. My motivation to work in public health really comes from my own personal experiences for health inequality. Growing up in a rural area in the South where there was limited access to health services, I knew that I wanted to some way help people who came from the same background as I do have healthier lives. So that's really where my passion comes from for public health. Well, I think when it comes to looking at an online degree, the first thing you got to think about is the structure of the course, how flexible it is, and can you fit it into your day-to-day life. The number one reason why I chose UNE is because of the flexibility of the course schedule, the ability to do coursework at my own time, but also have recorded lectures. This isn't self-directed learning on your own. There's so much supportive services that happen at UNE. Over any other program, I can't imagine having access to, the student support staff, the Academic Success Center. There's always different ways that you can interact with other other students outside of the classroom. So really, I would have to say the flexibility of the program. The cost was also a major factor for me. It was very affordable, financial aid being available, and supportive services make UNE my top choice. Well, one thing I can say to motivate any student who's currently taking classes is to stick with it. As busy adults and professionals, I know there's so many other opportunities and so many other things that we need to do, but I know that taking the time to invest in our education now is going to pay off spades later. So I would say stick with it, enjoy your time at UNE while you can, and use these skills to help your community.